the elders must be heard, elder wisdom in pandemic times. And I'm not claiming to speak for all the elders, but I think ROMEO is a good forum for discussion of issues. And I think wisdom comes through a consensus process. I don't believe it's just flashed into one person's mind as wisdom, but you share things and you refine them and you get wisdom. Now there's a psalm that I wanted to start with, a prayer of Moses, the man of God, the only psalm attributed to Moses, Psalm 90, has some relevant things for this pandemic time. I'd like to read some of the passages, starting with the first one. Lord, you have been our dwelling place in all generations. Before the mountains were brought forth, or ever you had formed the earth and the world, even from everlasting to everlasting, you are God. You turn man to destruction and say, return, O children of men. For 1,000 years in your sight are like yesterday when it is past, and like a watch in the night. So the perspective of his timelessness and looking at what we do. Skip a few verses, verse 9. For all our days have passed away in your wrath. We finish our years like a sigh. The days of our lives are 70 years. Let's emphasize that a little bit. And if by reason of strength they are 80 years, and I think Moses lived to be, 120 or something, but still he's revealing from God wisdom about what he, our creator, does to give us our span of days, 70 to 80 if we're strong. Yet their boast is only labor and sorrow, for it is soon cut off and we fly away. One of my favorite songs, I'll fly away, old glory. Who knows the power of your anger? For as the fear of you, so is your wrath. So teach us to number our days, that we may gain a heart of wisdom. And that's kind of the appeal here, is the heart of wisdom. And part of wisdom is recognizing our, we are but dust, and our span of time is limited. 70, if we're strong, 80 years. And so I went to look at how lifespans have developed in my lifetime, and this chart shows you what they call the population pyramid. On one side the men, other side the women, which is pretty much the same, a little more on the women's side, but typically over the decades. This starts in 1950 with the blue diamond or pyramid in the middle, and they're saying it's now changing from a pyramid shape to a box shape. And the green represents pretty much where we are now. It was done in 2018. A lot of the population statistics are a few years behind, so they give 2018 numbers, but there's the last actual numbers that you can see that it's widening in terms of as you go up in the pyramid of years, the 70-year period of time is, can you see my little cursor when I flash? So, that's the 70 years. A lot more people are living past 70 and 80 even, but eventually it tops off, and I don't think anyone's made it to Moses's ripe old age of 120 for a long time. And, but it seems to be as God intends, that he doesn't grant us life this side of eternity. So we have our days numbered, and we have to learn how to use them to search for wisdom. Notice the projections, so going from 2018 into the yellow zone. it looks like quite an explosion that they predict. And these are just speculations based upon, you know, their idea that things will continue the way they are. But look what's happening. This pandemic is going to change this this pyramid in some way, and who knows what will happen in the future. The point I'm making is God is sovereign even over these kinds of things. Now, death is part of the subject you have to face in looking at the subject of wisdom, if you will. And here's a couple of slides on death. This is the United States from 1990 to 2017, if you look across, and it's total number of deaths. That's why it's completely full. But it gives you percentages, and you notice that the vast majority of deaths come when you're 70 plus years old. No big surprise there, but that's 60, almost 65%. Consistently over decades. Not much change there. There's a little reduction in the number of the very young or the 15 to 49-year-olds at the purple bottom there. But even then, not too many die. But contrast that with Afghanistan. In Afghanistan, the red representing under 5-year-olds, look at the high number of deaths of children, of infants, really. There's a high infant mortality rate, and it's just been that way for a long time, and maybe a slight improvement presently, but it's a whole different situation in Afghanistan. As an example, and of course I deal with the Afghan Coalition and a lot of these issues that I'm talking to you about, I need to find ways to share with them. For contrast, China started back in 1990 looking more like Afghanistan in a way, a high child death, but they're looking more and more as the decades have progressed, they're looking more and more like our nation, where the death rate is primarily with the 70 plus. So here's some other things, because we're concerned about the pandemic deaths, you know, but look at the cause of death for children. And I'm thinking children now because we should be protecting the most vulnerable. In terms of society, you know, and children are typically that way. But look at most of them back in 1990. This slide emphasizes 90. You can see the little 1990. I'll contrast that in a little while. But
slide you had, the last slide you had on?
Yeah.
When it showed all, yeah, that one there. I have one of those I have to find for Nigeria, and it's road deaths is number 1, and malaria is number 2, AIDS is number 3.
Right, I know they have them for every country. This site, Our World in Data, it's very interesting, and they're interactive too, and you can spend a lot of time looking through this. But I just picked out a few for the purpose of looking back at 1990 as opposed to the latest numbers they have in 2017. And it goes from the major cause currently is cancer among children. Road accidents have been reduced. Maybe wearing seatbelts in the intervals might have contributed to that. Homicide is still about the same, maybe a little reduced, but still a major cause. Drowning and so forth. And then the world, you look at the whole world, and that's where it comes into what you were saying, Jerry, about Nigeria. They're probably closer to this one. Road accidents, cancers, malaria is a major cause of death among the young. and drowning and AIDS and diarrheal diseases and so forth.
Yeah.
So death is one of those things that we're concerned about. Now we're focusing on the world for 15 to 29-year-olds. That's the age of the core of society, working society, the students, and in the workplace. And cardiovascular disease tops everything, cancers, AIDS, and then road accidents. I thought these are interesting things from a global. And then United States, same age group, 15 to 49. It's come to be drug overdose is a major cause, which they have suicide as the fourth cause. And I don't know what the difference between drug overdose and suicide. I guess some of those drug overdoses weren't done purposefully as suicides, but look at the huge numbers. When we talk about a pandemic, you know, something that's preventable, something that should be dealt with, and just this is back in 2017, so it doesn't show us the impact of this COVID-19 pandemic, but it's giving us the big picture. Now, one thing I wanted to talk about is how we've dealt with pandemics in the past. Here's polio. Polio afflicted our country dramatically until a vaccine was introduced, and it was reaching a peak when I was born in 1950. That was the year that there were over 50,000 polio cases in the United States. And I was a fortunate kid because I didn't get a vaccination, but it must have been herd immunity that protected me. I didn't get a vaccination because I was raised up in Christian Science, and we didn't go to doctors, and we didn't do medicine. And I didn't become a follower of Jesus and get my head screwed on a little tighter until my 20s, early 20s. So my whole, you know, youth was avoiding medicine, but fortunately, herd immunity protected me. Now, you know, in 2017, most of the world is in green there, certified polio-free. There's two countries, Pakistan and Afghanistan, and a little bit in Nigeria there, who are red, which still have some problems. And the numbers are not huge, but there's still a presence of polio, and it could, without that vaccination, it could spread again. And that's why Africa is sort of in a vulnerable area. But it's being eradicated, and that's because of herd immunity and vaccination. Now we come to coronavirus, and talking about this fatality rate and breaking it down by age, I thought was an interesting way of looking at it. This, I think we all have heard, and we need to recognize the science that this particular pandemic is affecting the aged more than the young. I mean, just look at those numbers. There's very few who die from getting this, and I think that's speaking to issues like the church reopening and young parishioners. They kind of know, hey, we're not that susceptible here. Now, I don't think the churches of elders are going to rush back together, because they kind of understand this. We're more vulnerable just because we're in the older categories. Once you get to the 50s, it starts going up, and then it's like exponentially in terms of the fatality rate if you contract this. And it speaks for itself. But that's the science around the world. Different countries are contrasted. Here's one case study that was done, which I thought was interesting because it puts on one simple graph a case study that was done in China, if we can accept it as factual, but it seems to fit the facts of what happens. The red is the actual rate of death, but it can be misleading contrast with the blue, which is the actual total number of cases broken down. So the blue bars, if you take there are 44,672 cases in this study, right? It was a specific study of actual cases. And that's how those numbers break down. You know, the bars show that. That's based upon the number 44,672 and how it breaks down by age in terms of having COVID-19. These are all people who were contracted the disease, not how many in society, but of those, then it shows the percentage of fatalities, right? So out of the 1,430 80 plus, you've got 219 who died. And that's over 16% of that age category. So the same, you know, is true in all the reds. The actual numbers of deaths are given and the percentage of the number, the bar on top of them. So that's why I thought it was necessary to explain. But still, it shows that the death rate is greater the older you get. But once you get down into your 40s, 30s, very few people die. They contract it. Large numbers in their 50s contracted it and got the disease, but relatively few died relative to getting it. So society understands that this is the dynamic. That's why we have the rioters out and not paying attention to social distancing very much. A few of them have masks hanging around their neck, not even putting it on because they have to yell and shout things in the face of the police. So they're not being cautious because I think they understand they're not really in danger. It's like a common cold to them. And they don't, you know, this whole lockdown thing doesn't make sense to the rioters. It doesn't make sense to the churchgoers in many cases. And I think we have to realize that's what this information is doing to society. The facts are telling them they're not at risk. Well, who is at risk? We are. So what are the actions here in wrapping up? I think we have to figure that society needs to develop herd immunity by allowing exposure in the age groups below 50. Young families should socialize, open schools and summer camps, remove social distance restrictions on younger groups. The other thing we need to do, though, is to protect the elders, isolate the elders, provide safe spaces for those 60 plus. There needs to be more efforts on a quarantine until herd immunity and/or vaccination take place. Prioritize employing those who are immune, those who've recovered, in care facilities, and certainly all the necessary precautions. Designate outdoor areas for senior only. Now, this isn't you know, I thought, well, maybe this is something that could be done. National parks, certain ones designated senior only with RVs, have a protocol for making sure people have at least a 2-week zone of being symptom-free, but then let them socialize within realms of designated time and until this thing is over.
So Bruce, Bruce, the problem with that, it's easy to let people socialize. It doesn't cost you anything to have people run all over the place and do stuff. But when it comes to the older people, it's going to cost money. And therefore, it's probably not going to take place.
Well, it depends on where we spend the money. See, right now they're throwing out oodles of money broad-based, and they're not focusing it. And it could be more focused, and they need to have a plan and a strategy. And that's what I'm throwing out here is maybe we're ready for a plan on how to open up.
Well, you know, I mean, the same thing with the rioting. You know, they could be doing something in the underserved communities, but they don't. But they spend a lot of money on the cost of a riot and so forth, and then everything goes back to the way it was.
Yeah, well, that's because there isn't a plan, I think, and wisdom requires, teach us to number our days, teach us to think through the implications of things in our limited time and search for that heart of wisdom. And I'm just throwing this stuff out for discussion. I thank you for your feedback. Let me finish the little thing and then we can have more discussion. But here's the last point on this slide, is to equip and educate elders with tools of social media. That's kind of where I've been focused in the Afghan Coalition. I figure in this period of time, a year, maybe a little longer, until vaccination is available, the elders can be supported in certain ways, including get them connected with social media so they don't feel quite as isolated. All right, so now some more applications and actions proposed. The 50s age group, they need to have the choice between the young herd or the elder community. They can't bounce back and forth. If they herd intermingle, according to that case study, they have a 0.4% to 1.3% chance of dying if they get the virus by intermingling with the herd, right? They should be free to take the risk, but not alternate between the groups. You choose one group or the other in this isolation model. Once intermingling, they should not be allowed in the elder community until a 14-day symptom-free quarantine. This is the group in between. I'm assuming the elder group is going to be isolated, but these are the ones that are pre-elder. For economically challenged elders, which kind of gets to your point, Larry, financial aid should be provided to enable them to join a safe elder community. Elders can remain in quarantine in their own homes, kind of my situation, or join an elder community, or socialize within safe circles, like the national parks model that I mentioned. Provide safe spaces, could be outdoor spaces. More government financial aid might be available to help elders if the economy bounces back due to the removal of restrictions over younger age groups, because that's what's holding the economy back. And when the economy recovers, there will be more funding for various programs, if they can be focused where it's going to really help. And then those with pre-existing health problems, that wasn't even factored into the death, but we all know those so-called comorbidities, those factors like diabetes and heart disease and so forth, that are also accompanying the elder, need special quarantine provisions and financial aid, especially if not yet covered by Medicare. So those are all things that have to be considered, as well as the other vulnerable groups that need to be looked at, as studies have shown us. So the basic conclusions: open up society to accelerate herd immunity, continue to fast-track development of a vaccine, and facilitate quarantine of elderly and provide resources until they are immunized. So that's, that's basically the presentation. You've given a little feedback so far, but overall, what do you think?
I think you got a lot of good wisdom there. But one of the big issues I think you have to deal with is the fact that the economic difference between where most of us are fairly well financially compared to a lot of the more urban areas. And when you get down, if you notice, the death rate is much higher in the black community. The death rate, the infection rate is much higher in the urban cities because people are close together, and they just don't. They're not. The ability to isolate is much more difficult in those communities.
Yeah, it's gonna.
I don't have an answer. I'm just saying that's a problem that I think that's kind of complicating this.
Yeah, it complicates it, but there has to be a strategy. I think the absence of a strategy is that you try to do a total lockdown over everything, which is not really a strategy. It's kind of a panic attack. Yeah, they're not really thinking it through. So now that we have information, I think it's time voices to be heard, and the elders certainly being those most likely to be impacted, their voice needs to be heard. And so I'm just taking this step, and if we can share broader, get the ideas salted out there, talk about it a little bit.